everyone. Welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their thigh. And it's a condition known as Meralgia Paresthetica. It's a condition in which the lateral femoral cutaneous nerve, which exits around L2, L3, and comes and travels down and exits out right through here and innervates the sensory innervation from the lateral part of the thigh. And you can even feel sometimes numbing, tingling, burning sensation here in the lateral part of the thigh, kind of this pocket area as well. I brought out good old Netter here. This is Netter. This is the Atlas of Human Anatomy right here. And this is Netter. And I don't know if you can see this, but this is a great picture for the lateral femoral cutaneous nerve. So here it is. This is the nerve. If you see this little yellow, see this? So L2, L3 is where this sucker comes out of. You see that right there as I'm pointing? So it's right here. And you can kind of see it comes out right here, just underneath the psoas. See that? In front of the quadratus lumborum and in front of the iliacus here. And then it exits. This is the inguinal ligament right here. And it kind of perforates right through there. And then it comes out and innervates this is right here, lateral cutaneous nerve of the thigh, and it innervates the lateral part of the thigh. And anywhere along this line, along this nerve, if you get compression or adhesions or anything that interferes with its function, you're going to have symptoms of that going down the lateral part of the thigh. Well, in just a second here, Dr. K is going to go through 3 yoga moves that you can do, 3 yoga asanas or positions that you can do to help open that area up and free that nerve so that way those symptoms of burning, tingling, numbing into the lateral part of the thigh, that nerve, that lateral femoral cutaneous nerve can become free, and then you can get on with your life symptom free. So, in just a second here, I'm gonna have Dr. K take it away. All right, I got Dr. K here. She's going to take it away. She's going to go through 3 asanas or positions that you can do to help open up the lateral femoral cutaneous nerve. So Dr. K, go ahead and take it away.
These poses are more geared towards stretching for the anterior lateral thigh, front of the thigh area. So that's what we're focusing on, is opening up the front of the hip and the front of the thigh. We're going to start with a pose called the Crescent Pose. And when you're starting with the Crescent Pose, you're going to start in a mountain pose. So you're going to start at the top of your mat, and you're going to fold forward to come down, and then you're going to step back, bringing your knee down into a lunge position. You can see I'm in a lunge position. Now, dependent on where your front knee is, will depend on how deep the lunge is. So you're going to do this to tolerance where you feel a nice stretch. You're going to go ahead and you can lay that back foot down. And then the final part of this pose, I'm in my lunge, so I'm opening up this left thigh, and I'm breathing. As I breathe into this pose, you're going to breathe into this left front of your thigh. The next part is to take a deep breath in, out and in, and bring your arms up overhead, palms facing in, and then do a slight back bend again to comfort where you feel that stretch on the left side, because I'm doing the left side right now.
That looks fantastic. Now how long do you hold these typical poses there, Dr. K?
You want to hold for 15 to 30 seconds.
And you can kind of see, remember we kind of looked at Netter, guys, and we kind of saw where that lateral femoral cutaneous nerve comes out of the low back and goes down to the front of the thigh. You can kind of see from that picture and then this pose that Dr. K is doing, you can kind of see how that just kind of gives a little bit of it opens up that front right there and kind of gives a little bit of the traction into that nerve to help free it from maybe some adhesions in through there, or it could be entrapped right at the inguinal ligament.
And as you breathe, you can sink deeper either this way into your thigh, or you can sink deeper by bringing your back bend a little deeper as well. So 2 options, but again, you're going to take it to your tolerance. It's your pose, your body. So you need to listen to your body and breathe into what feels tight and painful.
Right, that's a good point, because a lot of people, sometimes they may have some back issues and those types of things. So again, like what Dr. K was saying, it's very, very important you do this to your tolerance, and it may take some time to be able to get you to certain ranges of motion. Again, you do it with your range in mind.
For some people, this may be enough. That may be, and that's okay. If this is where you're at, that's okay. If that's not, you can sink a little bit more, and then you can add in that back bend to further the stretch through the involved side.
Wow, that looks great. That looks like a great hip opener, abdominal opener. Also, you get that shoulder going. But again, you can kind of see if that tracing, that lateral femoral cutaneous nerve from the low back, you see how this just kind of opens it up and through there.
Make sure you're keeping your shoulders out of your ears. You don't want them up here. You want it down, and you're pressing down through your feet, pressing that hip down towards the ground as you back bend.
And don't forget to breathe. Breathing is very, very important too. I mean, we live in a world where it's kind of rush, 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 go, go, go. And it's kind of the shallow breathing, right? And that's what sometimes practicing yoga and meditation, that type of thing, it focuses on that deeper breathing, really kind of focusing on getting that parasympathetic nervous system to kick in instead of the sympathetics.
Breathing into the area that you're stretching.
Correct.
So the second pose that we're going to show you today to open up the front of the thigh and hip is the Pigeon Pose. So the side that is down in the Pigeon Pose is the side that you're going to be opening up. So I'm going to show you facing this way so you can see the side that's opening up. Now for this particular pose, you would start in a downward dog position. So again, you would have your mountain pose. You go into forward fold. Go ahead and put your arms down, stack your shoulders over your hands, step your feet back, get into your downward dog, and then from here, you're going to bring 1 foot forward. You're going to lay that leg down, and then I'm laying this leg, keeping this leg flat to the ground with my foot flat as well. I'm not up on my toes, but flat. And first you're just going to sink right here. And now this is where sometimes you may need to bring in a couple of yoga blocks depending on your flexibility. So for some people, this is going to be where they can go, and that's okay because we're opening this side, this hip. If this is all you can do right now, that's okay.
That's a good point. So you can kind of see here, if let's say you're having left side, because Dr. K is in this, her left thigh and leg are behind her here, and then her right thigh and leg are in front of her. So if you're having left-sided Meralgia Paresthetica issues, you can kind of see again, going back to that picture we showed you in Netter, you can see how this position right here just kind of opens up that front of the thigh and through there, and kind of where that lateral femoral cutaneous nerve comes right into the inguinal ligament, through the inguinal ligament right there. You can kind of see how this pose is awesome for that. And then again with the blocks, sometimes you can have to take away the blocks and just kind of lean forward a little bit more.
The progression is to actually come down onto your forearms if you can, and relax your head down and allow yourself to sink into that pose.
And realize this, because the left thigh is the kind of the involved side, but you look at this right thigh that Dr. Case, she's laying her torso down on the right thigh and leg. That really helps open up the right hip too. So it's kind of neat. You kill two birds with one stone. You're doing external rotation of the right thigh, but then you're doing hip extension with the left thigh with this Pigeon Pose. It's fantastic.
And we'll show you the other side. So again, going down into my downward dog first, and then bringing the leg forward to settle into that. And one side's going to be tighter than another. This is my tighter side. Again, just allow that to sink a little bit, settle into it. Once you feel like you're able to, you can come down to forearms like this. You can do forearms on the blocks if that's where you can go to. That's what's great about having a couple of blocks. It helps you as you progress. If you can bring it all the way down, then you come all the way down and allow yourself to sink.
It's fantastic. Now, so this would be the pose for the right thigh. If you have issues with the right thigh, Meralgia Paresthetica issues there, this is kind of the starting position for it. If you can't go down this far because of your external rotation on your left thigh and hip is decreased, again, you can go up, prop yourself up on the blocks right here. And again, the farther you prop yourself up, the more you're going to get traction of that lateral femoral cutaneous nerve on that right side there. The more you prop yourself up.
And then push yourself back up into a downward dog. And then you can walk your hands back. Finish off in your forward pose. And come up. That gets through your second pose. All right, so the third pose we're going to do is called a camel pose. And again, we're trying to open up the front of the hips, front of the thighs. And so the camel pose is actually one that involves a back bend as well. You're going to start seated like this, come up on your knees and legs. And what we're looking to do is open all of this up. So again, depending on your level of pain, your level of tightness, tolerance, all those things, you're going to vary this based on what you can do. I personally have tight hip flexors and I can't do a full camel pose. So when I get to the back part, you're going to see that I have to use the blocks because I can't actually reach my heels to hold on to. So for some people, just coming right here like this and putting their hands here on their back, this is going to be enough. We're actually opening this up. We're doing, again, a baby back bend. We're keeping our hips forward in line with our knees and bending back to open up this front part.
Yeah, and this is a great pose. Keep in mind, though, what I kind of like to do with this particular, I like to squeeze the glutes. That's a great, cue is to kind of squeeze your butt. Then what happens is as you squeeze your butt, your thigh kind of actually moves forward a little bit as you do that.
And so I was doing that without saying that.
Mm-hmm.
Now,
that's a good one, though.
A progression to get to as you're working your way towards actually getting back to touch your heels is to use the blocks again. So pushing those hips forward, locking those, or contracting those glutes, pushing the hips forward to be in line with the knees. And I'm leaning back, opening the shoulders, keeping them out of my ears, and opening all of this up. Again, it's going to be to tolerance.
Right,
Working your way back to where you can actually hold on to heels, which I can't really do, and push my hips forward. So you need to go to where your body's capability is able to do and be okay with that. Stop where your body goes to.
Right. The practice of yoga, it's been around for, millennia. As far back as, history kind of goes. And these are fantastic poses. As you can see, again, if we remember what we showed you in Netter, where that lateral femoral cutaneous nerve, how it travels through the abdomen and through there and in front of the thigh, you can see how these poses will help to open that up. And by practicing them on a regular basis, that's going to help alleviate a lot of the issues that some folks have with Meralgia Paresthetica. It just gets adhered in there. That nerve just gets adhered, scar tissue, just tightness of that whole front area. Because again, we sit way too much, and these three poses are going to help open that up for you.
So since this pose is a little more advanced, and it's usually after you've warmed up, more towards the end of a yoga practice, like I said, you just do where you can do to. If this is all you can do, then just do that. Slowly working your legs, your arms down and back, and just take it in progression.
Right. That's a good point. And also, Well, we usually recommend typically when you're holding stretches or in this case poses for yoga, again, 30 seconds to a minute minimum, kind of 15 to 30 seconds to start with if you're having difficulty. And then over time you work up to, you know, a full couple minutes to where you're doing these. So
that's 3 poses that we just shared with you. The crescent lunge pose is the first one that we did. Then we moved into the pigeon pose, and then we completed with camel pose. So those 3 poses to stretch the front of the thighs, open up the front of the hips area to deal with and address Meralgia Paresthetica if you're having numbness, tingling, pain, those types of things in the front of the thigh.
if you have any questions with this video, drop it off in the comment section below. I want to thank Dr. K for doing those poses. You know, we're novice yoga practitioners,
Yes.
and so, but we wanted to give you an option. You know, the Meralgia Paresthetica is something we see actually quite often in this office. And these are 3 great yoga poses that you can do at home to help alleviate some of those issues when it comes to Meralgia Paresthetica. Anyway, we thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well and live well. Also, we know you know folks who are battling thigh numbness, tingling, pain, burning sensation here in the thigh, especially in the lateral part of the thigh. They may have Meralgia Paresthetica. Share this with them. Sharing is caring. That way they can continue to move well and live well also. And give us a thumbs up, give us a like. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.